Yeah, I do. 1, 2, 3, 4, or 3, 4, 5.
Do you have back pain? Statistics show that 9 out of 10 adults do, and it's the #2 leading complaint in the doctor's office. Hi, my name is Mary, and I'm here to inform you on safe and effective ways to manage back pain. I've had back pain for 10 years now, and you might be asking, why so long? Well, Dr. Block, Division of Health Psychology, says it best. He says, chronic pain can sometimes be perceived as a nuisance, something to be overcome in order to continue the activity. And this is how I thought for a really long time. I thought my physical pain was something I needed to mentally overcome, and but the pain progressively got worse. So I did see a specialist, and he told me that I had early onset arthritis. And as you may know, this can be very painful. So he sent me home with painkillers, as most doctors will do even before a diagnosis. In a minute, we'll talk about the dangers of such pills, but first I'd like to focus on safe and effective ways to manage your back pain. Excuse me. These tips can often be very therapeutic and have more than one positive outcome. Even if you have little to no back pain, this still pertains to you, because if you have bad habits with posture, for instance, then you could develop back pain later in life. Good posture will prevent you from having injuries. My friend Steve here is going to demonstrate proper posture for you. When standing, keep your chest out, stomach tight, and chin in. One foot slightly in front of the other. When lifting, keep your back straight, squat low to the object, and don't bend your back. Lift with your core muscles and not your back. When sitting, you should have your back supported by the back of the chair. You could have a small towel or a roll towel or a small pillow in between your lower back and the back of the chair, but keep your feet flat on the floor and your shoulders relaxed. If you sleep on your side, you can put a pillow in between your knees. This will put your spine in a neutral position. If you sleep on your back, you can put the pillow underneath your knees. This again will put your spine in a neutral position, but avoid sleeping on your stomach. And a firm mattress is a good mattress. You can also eliminate some pain by changing your diet. Pain specialist Dr. Wendell says that minimizing foods that promote prostaglandin will eliminate some of your pain and help you lose weight as a nice side effect. Prostaglandin is produced by trans fats or fatty acids. So if you cut some of the fat out of your diet, then you'll eliminate some of your pain as well. At-home therapy is great because anything you can do that relieves stress will help relieve some of the tension that causes you pain in your back. You could try cold compress therapy with an ice pack, or you could try heat therapy with a heating pad. But there are plenty of other over-the-counter products that you could try too. My personal favorite is the Icy Hot Roll-On Gel. It's got immediate soothing sensation. It says lasts for a few hours, but for me it lasts all day. It's really great. You could try yoga or deep stretching for 20 minutes a day to help strengthen your core muscles, which supports your back muscles. Or you could go for a walk, or any kind of physical activity is good, and it will benefit your health in general. The last thing you want to do, though, is stay on bed rest. This is counterproductive because it actually makes your muscles more stiff and tight. These tricks, they're easily accessible, they are therapeutic, enjoyable, they often have more than one benefit, and they're cheap or free, which is great because people spend billions of dollars a year on pills or doctors alone. However, you might feel more comfortable with an expert, a professional that knows what they're doing, like physical therapists or chiropractors, for instance, who will have you do proper exercises for your specific condition and encourage a more healthy lifestyle in general. Painkillers are a pain remedy, however, I wouldn't recommend them because they can be dangerous. Dr. Atman, cardiologist and professor at Harvard Medical School, says that painkillers have often been led to stomach bleeding, kidney failure, and heart problems. And like most drugs, painkillers can be very addictive, and your body can become dependent on it. It's more of a mask than rather a solution. So, they also have side effects like nausea, dizziness, and drowsiness. I actually had bad side effects when I was prescribed these medicines. I had to lay on the couch and wait for the effects to wear off, and that was frustrating, not being able to function normally. So that's what inspired me to find these other tips and tricks to manage my back pain safely and effectively. That's when I started doing my yoga and stretching every day and changed my diet and found my go-to product, Icy Hot. Whatever you choose to do, it's better than doing nothing. Experts at Cleveland Clinic agree that the pain will progressively become worse if ignored. So in conclusion, I encourage you to try these tips. One might work better than the other, two might work better than one, but the point is find what works best for you and be proactive about it. I hope now you have a better understanding of the causes, effects, and solutions of back pain. And thank you to my audience so much for coming today and my virtual audience for your attention. Can you help me upload this?